reversible. I'm not going to tell you that 100% of diabetes can be reversed. Type 1, we don't really know if anyone can be helped, but I would venture to say that 98% or more of type 2 diabetes is completely reversible. If you have any insulin production at all left, then it's just a matter of lifestyle. What factors affect insulin resistance? Well, we talked about food. Anything with a high glycemic index is going to make the sugar rush into the bloodstream and stress the system and cause a physiological adaptation. So that's the number one. But we also need to understand that stress raises cortisol. Whenever you're stressed, your body believes that it has to perform extra work, that there's an emergency it has to defend itself against, and it's going to need energy to expend during this emergency. So it will tell all your tissues to raise the blood sugar. It will start breaking down protein to convert some of that into blood sugar, and it will give you cravings so that you can raise your blood sugar even more. That's why people who are stressed have cravings. It's because of cortisol. There are drugs, there are some specifically called Tequin and Seroquel that have been linked to developing diabetes. But anything with cortisone, corticosteroid, the medical form of cortisone, is the version of human cortisol. So anytime that you take those drugs, which are supposed to be anti-inflammatory, you also raise your blood sugar. And you're setting yourself up for insulin resistance. Now let's look at the good side. How do we help it? Exercise, exercise, exercise. Okay, first of all, you're burning off sugar, but secondly, you're reducing insulin resistance because your cells become more sensitive to insulin when you're exercising. You need none or very little insulin to absorb the sugar. So most type 2 diabetes, you can pretty much get off insulin instantly if you just start exercising enough and keeping your blood sugar, the foods level. Good heart rate variability. The things we're talking about in this office, breathing and heart rate variability, it is linked to all of these mechanisms. So when you increase your heart rate variability, you reduce your stress, you reduce your cortisol, and it has been inversely linked to developing of diabetes. Chiropractic reduces stress for many reasons, and we'll talk about that separately because there's a lot of neurological mechanisms. But it's known that chiropractic reduces stress. People feel better. We'll talk about the details. And breathing exercises, like I said, heart rate variability. Breathing exercises, feeling good, feeling relaxed, practicing relaxation, visualizations, they all reduce stress, and all of that will help with reducing insulin resistance. So now, I think I've got you sort of paying attention and thinking that, you know, this is more than just a curiosity. So being a chiropractor and talking about this is my passion. This is what it's all about. It's the big picture. Back pain, schmack pain. It's like, who cares? Back pain just indicates that there's something in the body that isn't working. That's the tip of the iceberg. The diabetes and the heart disease and the strokes and all of that stuff, that's the bigger picture. That's what we're really working for. And as you well know, chiropractic affects the brain, it reduces stress, and it helps with all of these things. Okay? So, in chiropractic, the stage 1, that's just initial crisis care. That's just reversing the pain, breaking the patterns, and getting people feeling better. Unfortunately, most people think it's just about pain, so as soon as they feel better, they think they're all better. And then they go get diabetes or heart disease or something else a few years later. But what we're talking about is to continue this until everything in the body that's supposed to work is working. So stage 2 is stabilization care. That means that we keep going past the pain. We work on the nervous system. we work on exercising and doing specific things to balance out nervous system to become more stable. A more stable nervous system and brain can handle stress, and it can turn off and balance sympathetics, parasympathetics better. It's all nervous system. And then stage 3, once we get up to a good level, now we need to maintain that lifestyle. We get maintenance chiropractic for peak performance, and we keep doing all the right things to maintain top function. Check out the previous talk we did on heart rate variability, and you can see how it affects immune system, immunoglobulins, how it affects cortisol, DHEA, how it affects cognitive performance and reaction time. We're truly talking peak performance. So it's not about pain. That's just the tiny little thing we get started with. It's about quality of life at any age. So the people who are still young and don't have many symptoms, that's the time to start taking care of things. By the time you're 65 and you're 40 years into a disease process, you already have so much degeneration that it's much harder to turn it around to get a quality life again. So if there are any questions, we'll take those now. And other than that, I would like to thank you very much for coming.